You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more loose-fitting denture. My first guest is an expert on mini dental implants, Dr. Dave Powers. Dr. Powers, welcome to the program.
Thank you very much.
All right, now before we get into today's topic, I know you brought a lot of photos, and you want to make sure we fit them in, and you brought models, so it'd be interesting to see that. Tell us about your practice, though. I mean, you do more than just mini implants.
Oh, absolutely. We're just a general dental practice in Temecula, and we treat all kinds of patients. We treat all kinds of we do all kinds of procedures. We do everything from crown and bridge to cosmetics. There's different people that come in and see us for different aspects of dentistry, but mostly my focus is on mini dental implants and helping the denture wearer improve their life.
Okay, good. Now, dentistry runs in your family. You have a brother.
Absolutely, I have a brother.
Dentist.
I've worked with for several years, and we have both, kind of made our focus on dentistry in mini dental implants.
Okay, so your goal. I thought it was good. I always like when a doctor tells me that. I mean, your goal is to be the premier center.
Absolutely.
In Southern California for mini dental implants.
Yeah. It's not so much my goal. I want to actually help people more in this aspect, because I know the mini dental implant can be a definite change in anyone's life that gets it. It's something that they will improve their life, will improve their chewing, will improve their quality of life for sure. I'm very confident of that.
Okay, good. Now let's talk a little bit about your background and training after dental school.
Yeah, after I got out of dental school, I was doing general dentistry. I started doing dental implants, and I was trained in a couple of different systems. And I went to a seminar and saw what a gentleman was doing with the mini dental implants, the improvements he was making on typical traditional implant dentistry, and I was amazed. And I said, this could be the future of dentistry. And so I followed him around the country, and oddly enough, I'm actually lecturing with him now.
So you teach other dentists about mini implants, because a lot of doctors, and I got to tell you something, because people need to know, I'm not siding with you here. I'm just asking the questions. A lot of dentists going, I don't know about mini implants. They're temporary.
Yeah,
I
get that a lot, Randy, and
Yeah, what is your response?
My response to that is there's alternatives.
I mean, do they work?
Absolutely, they work. I'm 100% sure. My passion is in mini dental implant dentistry and getting these patients to understand that they have an alternative. That they don't. All these people that are having these traditional type of implants, they're putting out thousands and thousands of dollars and waiting a long time for some of these things to work. Where the mini dental implant, we can do it for much less cost.
It's more than half off.
Absolutely,
you're saying.
And less invasive for the patient. They're not waiting around for healing time, and they get immediate results. And it's
okay. And the results are that a denture wearer, you put in 10, 12 of these little implants, snap in, snap out, no more adhesive. What can they eat, though, by the way?
Immediately. They can, what can they eat? They pretty much can eat anything. What my patients have typically told me.
Yeah, what do they tell you?
They typically tell me that they're able to eat anything. I've had patients tell me they've eaten a hamburger for the first time in 20 years because their denture was slopping around. A lot of these patients will walk into my office with their denture in their pocket because it just falls all over the place. And so I'm able to tell them in as little as an hour, one visit, we can actually secure that denture in their mouth with at about half the cost of traditional implants.
Okay, so let's talk about patients for a moment. What are the different categories of mini dental implant patients? I mean, who benefits the most?
Well, what I find is anyone missing one to all of their teeth. Basically, we can help anyone in that aspect. We do different types of dentistry on these mini dental implants. You can do a fixed restoration, which means they don't have to take it in and out. Or we can actually have, like you said earlier, you can do a snap in and out denture, which is typically what I do most of the time.
Help me understand the advantages, if you're just missing one tooth, why a mini implant would be better than what traditional dentistry?
Yeah, what I think the biggest advantage is in typical dentistry, what we did in the past is a bridge, where we'd have to actually grind down the two adjacent teeth and put a fixed prosthesis in that area. Bridge, basically a false tooth connected to the other two natural teeth. Well, nowadays we don't have to touch those teeth. We can leave them alone, and we can actually go right into the gum and the bone and put a tooth in it immediately.
And this doesn't hurt, you say?
Not at all.
Really? Now, your mother, you told me a story. I said, you go, I don't tell this to patients. I go, you got to tell this story.
Yeah, what's funny about this, Randy, is when I got involved in mini dental implant dentistry, I had to find somebody to try it out on, and because I was very skeptical, as everyone else is. But my mother was a patient that was suffering with a partial denture, and basically I went in and I did a few mini dental implants, and I actually got rid of her partial. I gave her something that stayed in her mouth, and it was the greatest thing in the world.
But tell me what you said right when you did it.
Well, I got done with doing that procedure. I pushed my chair back from the chair. I said, that's it? It is the easiest thing I've ever done in dentistry.
Really?
Absolutely.
Now, so I understand this correctly. Okay, so the big pain that people would think about when it comes to dental implants or anything is because of the cutting for the
Absolutely.
the gums.
A lot of invasive surgery done.
But with mini implants, what? It's just kind of poke through?
Absolutely. You put a little pilot hole through the gum into the bone, and you actually thread the implant in. It's a self-tapping type of thread, just same as you would put a wood screw in a piece of wood.
So it doesn't hurt? I mean, it doesn't hurt? The bone has no feeling?
The bone doesn't have any nerve endings in it. It's mostly the gum, and if you don't have to cut through the gum and do it in a surgery type of situation, you don't have any pain.
Okay, so now denture wearers, how many denture wearers are in Temecula, by the way?
Oh, God.
Tens of thousands? 5,000?
Absolutely. Tens of thousands.
Really?
And the outside or the surrounding areas.
Okay, now if these mini implants are as good as you say they are, where you could just give them mini implants, something really snap in tight, why aren't they all doing it?
Well, I would say because
like denture wearers to snap in, snap out.
Absolutely. The typical denture wearer hasn't been to the dentist in many years. They usually only go in for little adjustments and relines, or actually to make a new set of teeth, which really doesn't improve much for them other than the looks of the teeth. The typical denture wearer.
So they're not going to the dentist?
Not going to the dentist.
Interesting, okay.
Yeah. I mean, they've had bad experiences. Obviously, they had to have all their teeth taken out and dentures put in, and that's not a comfortable thing to have.
So the last thing they want to do is go to a dentist again?
Yeah, the last experience they had in the dentist was having their teeth removed, and it was a terrible thing. So they're not going to go back. They feel like the problems were solved once they got rid of all their teeth. Well, they've found they have a new set of problems, and that is loose, ill-fitting, uncomfortable dentures that don't really have really good chewing efficiency.
Now, I've told this to other dentists, but my mother, 75, told me, I told her I was excited about dental implants when I first heard about it, and she goes, well, my medical doctor said I'm too old. So at 75, can you still get mini implants?
Absolutely.
I know you can get regular implants. Could you get mini?
Absolutely. The misconception of the elderly is that they're too old, their health problems are too involved for them to get mini dental implants, and that is not true. I will tell you, I have yet to find a patient that hasn't been a candidate for the mini.
Do you have to put some bone building material in certain cases?
Absolutely not. Most cases not. No.
Really?
I would say about 99% of the cases I have not had to do any kind of bone grafting technique or any kind of addition of bone. Basically, the mini implant has been made for the bone that the patient has.
So what are the complaints, by the way, that denture wear? I mean, I know a few denture wearers. I've never heard one complaint out of these people. I mean, what do they tell you? I mean, what's the problem?
The first thing is they got to take their teeth in and out. I mean, that's going to be embarrassing in the first place.
Obvious, yeah.
But second of all, the complaint is they can't chew. It hurts. The thing swims around in their mouth, and it's very difficult to speak clearly because they're clicking and they move around. They hurt. And so they need something that's going to secure that denture down onto their jaw, and this is the perfect thing.
So what's the younger end of the spectrum for the denture wearers?
Well, typically we think of elderly people as a lot of people having dentures. Well, when we get into younger adults that actually have dentures, you may not even know that they have them because typically they're introverted. They don't come out into public.
Like how old? I mean, really?
Anywhere from 30.
Really? There's 30-year-olds
Absolutely.
Wearing dentures?
We have patients come in that are wearing dentures. And frankly, I'm surprised. And these are the patients that are going to be wearing these dentures for the rest of their lives if they don't do something about it. And I think typically when they come into my office, they finally feel relieved that they found a place that actually is going to help them, enable them to go out in the social scene again, be able to kiss without their teeth moving around.
Interesting, that's right.
And keep them.
People are dating at 70, all at 80.
Absolutely. People are embarrassed to wear these dentures because they're afraid they're going to sneeze and they're going to fall out.
What is the one common theme after it's all done? They get their teeth. What do they say to you?
I'd say it's changed my life. It's changed my life. I have more confidence. I'm able to eat whatever I want. And more than anything, the confidence level is just phenomenal. Do
they act differently when they walk in?
Differently. They start getting their hair done. They start doing their makeup more. They trim their mustaches. They're finally taking pride in themselves because their self-esteem has been very low.
Now, I'm not trying to be insensitive here, but it does sound like an exaggeration. It means you give them their teeth back.
Absolutely.
And you see these transformations,
absolutely,
personality-wise.
And I will tell you, in typical dentistry, nobody likes to go to the dentist. Going in to have a root canal done, you're not going to give your dentist a big hug and a kiss after he gives you a root canal. In my office, when I do these procedures, these patients.
The denture wear. What about the denture wear?
Many of the denture wearers want to get up and give me a big hug and a kiss and tell me how they changed their life. They're willing to do any kind of testimonial. I get gifts. I get gift cards from places that they've eaten, saying this is the first time I've ever been to eat comfortably in this restaurant, and they want me to experience the same thing.
Show me that little model you showed me in the green room. The little, actually the other model. That pretty interesting here.
Well, typically,
do you show this to patients?
I do. I show this to patients just to give them an idea. And I am a dentist that does both traditional and mini dental implants. But the fact is, I have found that the mini dental implant is so much.
Tilt that so we can see it. I'll try to get a zoom in. That right there. Okay. That's good.
Basically, this is a traditional type of implant, and that's the size of hole that we have to place for that traditional type of implant. The way this is done is the gum is filleted open, and you actually place this traditional implant in, you close it back up and let it heal for typically about 3 to 4 months.
Okay.
And then we can come back and put a tooth on it. The mini dental implant, we have to put a hole about that size, and this is a typical mini dental implant completely.
It's very small.
It's very small. And we're able to thread.
But is it secure enough? I mean,
very secure.
It's not too small?
Absolutely not.
I mean, is it strong enough to be able to chew things?
Yes, it is. But what we use, Randy, is when we do mini dental implants, we actually use more of them when we place a tooth.
Okay, than traditional.
Absolutely, absolutely. We place, typically we will place 1 mini implant per root that you're missing.
All right.
Which is not the way it is in traditional implants. That way you have a more broad spread of chewing force.
Okay, yeah. Okay. Now, so let's go over the options then, by the way, that denture wearers have, and you have models there.
I do.
So this is just like what you do with your regular patients.
Absolutely.
They come in.
I bring these models into the office. Basically what I'll tell them is, okay, this is how we would secure your denture if you were to do this procedure. Basically what I'll do is I'll actually place 4 of the mini dental implants.
So okay, that's 4?
Yeah, so what we typically do is we put 4 in the lower jaw here, and basically we have a rubber type of ring inside the denture.
Let me see that, okay.
Inside the denture, and we're able to snap it right down onto that ball of the top of the.
How snug is that, by the way?
It's pretty snug. You can pull on it yourself, and I hand it to the patient, let them feel it, and there's nothing that they've ever been able, even a partial denture, that they've been able to hold in their mouth that strong. And it stabilizes it, holds them. They're able to bite through anything.
Why do you like this so much, by the way?
I love it.
Because you do. I mean, you're into it.
You know what I love about this is it's so versatile and it's so easy. For me and the patient.
Is it rewarding for you? I mean, I don't want to seem like I'm siding with you here, but I mean, you really kind of.
It's the most rewarding thing in dentistry I've ever had. I can tell you, as I said earlier, you don't enjoy doing a root canal on somebody, and they don't enjoy having it done. But I'll tell you, this is the first thing in dentistry that I've done that the patient is actually happier when they. Happy to come in.
What are the age ranges then on the older patients?
Right, the older patients, 55 and older is usually what are my typical patients, but anybody that's wearing a denture.
What's the oldest patient you've had for mini implants?
94.
94-year-old? Why would a 94-year-old want mini implants?
Well, just like anybody else would, because they want to be able to chew, they want to be comfortable, they want to feel normal. They don't want to have something they take in and out of their mouth. They're tired of having all these dental problems. And as we get older, our teeth do get a lot more brittle. We have more dental problems, and they want an alternative other than what their friends are having that they hear the complaints.
Now we should mention you're 6'6".
I am.
Right?
Yes.
You know, it's like that's a scary dentist.
I try and sit down in the chair when I talk to my patients.
You said with kids you actually kind of roll in the room.
Absolutely. I don't like to stand up. I mean, I would be intimidated by my size. So.
You don't look like a dentist.
I know. And when people ask, at parties, I try and stay away from it. I tell them a truck driver or something like that because I look more like a truck
That's
driver.
more believable.
Yeah, it's more
definitely more believable. But, okay, you brought some photos. What are we looking at there?
Well, I want to show you a couple of patients that's basically the ones that have been more of an emotional thing for me than anything, because they have typically come in and said, hey, you've changed my life. And I know I've changed their life because it's just in the way their appearance. It's the father of a friend of mine who was having some health problems. He was typically having a lot of problems chewing, loved to eat food but couldn't eat it well, was telling me about his problems with adhesives and having to wear these partials, and that's not an uncommon story. I hear it every day in my practice, and I'm sure people, his friends have the same problems. He's referred a lot of people into me that have had the same problems. Well, what we did for Bill was we were able to kind of overhaul Bill's mouth, and by giving him some snap-in dentures, he was immediately eating foods that he couldn't before, that he'd have to cut up, he'd have to blend, was enjoying going out to dinner again. Look at him side by side. He looks younger, he's smiling, but most of all, he's eating better. He's able to chew and function, and that's the biggest smile he has on his face.
Like, by the way, are you a little worried, after you get it done, where they want to, how soon can they start eating, I should ask you?
Typically, most patients are able to eat the same day.
Oh, really?
You're able to use these immediately. So obviously we start them off on a soft diet for the first day or two, just because there could be.
But like in 2 weeks, this guy could be eating. This guy right here could be eating a corn on the cob.
Absolutely, because
really?
It's stabilized. If you look at what we did for him,
let's take a look.
Basically, we did the same thing that are on these models to Bill that I have on these models. I put 4 mini implants and gave him a new denture on the bottom. I did 6 mini implants. Gave him on the top, gave him his denture on the top.
Tell me about this. Why more on the top than the bottom?
Typically, the bone on the top jaw is a little bit softer. We like to spread it out, and also because we cut out the palate of the upper denture.
So there's no palate on these.
There's no palate, which is another addition to that's very positive about these that a lot of patients love is they're typically the denture that they have has a palate and it covers the roof of the mouth. That's why that's the name plate. And they say this is my full leather denture plate. What we're able to do is once we put the mini dental implants in, we're able to cut out that palate because we don't need that anymore for suction. It actually holds it in place without having to use it, because that's typically where they put their denture adhesive to hold it up in there.
Is that right?
Absolutely. Patients are able to taste their food better. They're able to feel hot and cold liquids. They have a more feeling of natural teeth rather than having this big piece of plastic in their mouth.
Okay, and cleaning and things like that, just
same as every other denture wearer. Basically, we give them great instructions on how to keep them clean and also keep the implants clean. We like them to keep the implants clean because we don't want any irritation of the gum around there. But it's not, obviously they're never going to decay.
Now, is there a success rate? I know with regular implants, I hear things like 98% success rate,
Absolutely.
meaning they don't fall out.
Absolutely.
Means if you decide to move forward with a procedure, can you quote a success rate?
Yeah, absolutely, 95% success rate with these. Absolutely, I've done over 3,500
really
placements of these. Yes, and I've had a 95% success rate. They're phenomenal,
So 3,500 implants later. Is there a learning curve? I mean, are you that much better now?
Absolutely, there's a learning curve. I was trained. I went to several of these courses. I don't know why I went to several. I just enjoyed it, listening to it, because after the first hour or two, it's that easy to learn. It's a very simple procedure for the doctor to learn. It's a very simple procedure for the patient to have.
Now we're going to take a break in just a few, but you have more photos over there. What are we looking at?
I do. This patient came in. This is a very common thing that I see, but a lot of people don't see in the public because they're.
That's common right there?
Absolutely. They come in. This is many years of neglect. They don't want to go to the dentist because they don't like going to the dentist. They have their fears, and they have the misconception that the dentist is only there to hurt them and not to help them. Well, I'm here to actually change their minds about that.
Okay.
This person comes in as a referral from his grandmother, who I did many dental implants on, and wanted to see if I could do anything for him. Well, when he walked in the office, anybody would be very, very taken back by this photo. But to me,
that's a man?
I see. This is a
How
man.
old? How old is this?
He is 36 years old. 36
Wow.
years old with teeth like this.
Interesting.
When he came in, he told me, I want something that stays in my mouth. I really don't want to have to take anything out. I'm too young. I feel like I'm too young for a denture. Well, looking at this, you don't have a lot of choices. But we were able to actually rebuild his mouth with both cosmetic dentistry and mini dental implants to enable him to function and smile. And then now at this point, this young man he's married. He has a child on the way.
Okay.
And the happiest I've ever seen him. He has been holding up his hand over his mouth for years and still has the habit, and we're trying to break him of the habit of having to hold his hand over his mouth.
And it doesn't hurt. I mean,
it doesn't
pain,
hurt.
I mean, I don't want to have disclaimers all over the show that says, the results not typical, but do the patients, pain is not something they complain about.
Now, if we think about it, Randy, the bone doesn't have any feeling. And if you think about what we're doing, we're basically making a 1 millimeter pilot hole through the gum, and we're actually threading the implant into a bone that doesn't have any nerve endings in it. It's basically just the gum that has a little bit of irritation.
Do they have to take pain meds the next day?
Mostly no. No, never.
What do they take? Like Advil?
Advil, Motrin. Let me back up for a moment, Randy, and tell you a little bit about this gentleman. 36-year-old guy, bad breath, very, very unhealthy gums, very unhealthy mouth. So we had to do kind of a combination case for him to get his mouth back to where he could function and also smile, and also more than anything, it's healthy.
All right.
So basically what we did, people don't understand this, but there is a lot of gum disease in this mouth, but we're able to rid him of that gum disease.
How?
By removing some of the teeth and also cleaning up the gums. People don't typically realize that you can remove the teeth and the gum disease will go away.
Because it lives on the root of the gum.
Absolutely, it lives on the root of the teeth.
Okay.
So they actually will cover up. And in those spaces, we were able to put mini dental implants and also do some cosmetic veneers on the teeth that we were able to save. And we gave this guy a whole new life.
Now he's got $1 million smile.
He does. This guy is a funny guy. He came in even with a great attitude, but I could see the little bit of disgust that he had with his mouth. He'd cover his mouth. He wouldn't want to show it. But he was a very, very nice, funny guy. And I'll tell you, once he got his teeth, he actually met a woman, got married. He's having a child. That's how it changes your life.
What about in this economy, though? What's your case for, the denture wearer that in this economy, why should they do it?
Well, I think more than anything, it's a confidence builder. People are going to feel better about themselves. They're going to be able to function. And, a lot of these people are teachers, doctors, lawyers.
So it's like investing in yourself. You look at it that way?
It's investing in yourself. It's making yourself look better, feel better. We all want to have a beautiful smile. We all want to eat. A lot of these people come in and all they want to do is be able to chew. And when they leave my office, not only can they chew, they have a great smile and they're confident.
So this young guy, by the way, back it up to this guy, you said he got married. Did he tell you that he met her because of the smile, or that's your?
Absolutely. He
oh,
feels
really?
his confidence is much higher.
Okay, okay.
Now, I'm not saying that that's why, but I will tell you that he.
Well, somebody smiling is more approachable. There's no doubt about it.
Absolutely. Your confidence level is high. I mean, come on, let's face it. Would you walk in a place without a set of teeth, or would you rather walk in a place and meet people with teeth or without it? And I mean, it's a very easy question to answer. Yes, but it's something that everyone takes for granted. And until you're in that position, until you have a bad set of teeth, you don't know what it's like. These people are suffering through this, and they don't have to.
Now, what about the cosmetic aspect of this? I mean, can you make them look real?
Absolutely.
I feel like I could spot a denture walking down the street.
Absolutely. Most people are very aware of that. They don't want it to make it look real. I'll tell you, the most common want for the patient is they do not want it to look like a denture. And I typically
they say that? Okay.
Absolutely. I work very hard with my lab to make these things look as natural as possible, and we do a pretty good job. Going back to Bill, I mean, if you look at Bill, yes, he doesn't have a Hollywood smile, but what he has is something that's more age appropriate. His teeth aren't bleach white. We actually made to make it look like it's.
Oh, so you choose color.
I help the patient choose what I feel is best for them, and they also have their input. It's not just my choice. The patients will give me, typically women want their teeth very, very white, and when they realize how white they are, they will have second thoughts about it. So I help them, and I show them pictures of patients that have the whiter teeth and the darker teeth. And
is it more women that are coming in for mini dental implants?
I would say yes. They're usually.
What do you think it is? I mean, the men wait till the last second,
absolutely.
To do something?
Basically, men, you typically don't come in unless it hurts. It's not more of an appearance; it's more of a function. And when they can't eat, that's probably the most.
So, what do you say to these men watching this that have a denture?
What I would tell
them, as far as what they're missing out on.
Right. What I'll tell them is, man, you're missing out on having a great smile and able to function so much better than.
You say function. I mean, what do you mean function?
You may be able to chew. You're able to chew. You're able to talk. You're able to actually pronounce your words better. Anything that's done with the mouth, you're able to do better.
Okay.
I mean, it's basically going to enable you to again speak with confidence, chew with confidence.
Is there such thing as a happy denture wear?
No, I don't think there's anybody who feels happy after they get a denture. I feel that they have traded one problem for another. They've gotten rid of the problems that they had with their teeth, but they basically got a set of teeth that they really can't use well, function well, and feel comfortable with. So it's something that definitely can be improved. They have an option now. I mean, we're able to improve that for them by giving them a denture that's secure, giving them a denture that looks more natural.
So with as little as just 4 mini implants, snap in, snap out, 12 ideally, really gives them something, and I don't want to put words in your mouth, but 12 little implants, right, and give them something really strong.
Absolutely. We can do something that's fixed in there, but typically...
Can they chew a steak?
Absolutely. They can chew anything they want. I've had patients bite through corn on the cob, an apple. Patients have come in. I had a gentleman who's a fisherman come in, and he's able to chew through his fishing line now, and he wears out one tooth on the denture.
Are you kidding me?
He's breaking the tooth off the denture, and I keep having to put it back in because he breaks it off the denture with his fishing line.
So he can pull the fishing line, and they don't come out?
No, they do not. They are secure, solid, and he says his comment to me was that it was the most natural feeling his teeth have felt in 30 years since he's had a denture.
Okay.
Which has been 30 years.
Now I hear with traditional implants, they'll say, Randy, we have to be careful because they can make it to where they can't take it out of their mouth. Is that true in certain cases where it could be too tight?
The patients, yeah, we have ways of helping patients with that. A lot of these elderly patients, their dexterity is very limited, and we help them with that by we have different tensions of the rings.
Oh, so you could loosen it?
Absolutely. I mean, we can put less rings in. I mean, there's a lot of different ways to help them. But most patients, I'll tell you, they put them in. They don't want to take them out. They feel better with them in. Absolutely. And I will tell you, a lot of the denture wearers that first come in and see me, they have their dentures in their pocket because they're very uncomfortable to
wear. Is that true they do that?
They do that. They walk in with them
with nothing in their mouth?
And I'm like, what are they doing in your pocket? They said, I only put it in for appearance. Because they can't chew with them, and they hurt, they feel terrible. And I said, well, we can definitely help you with that.
So this is, I mean, to recap here, mini dental implants. You say they work, they're effective, they're a lot less expensive than traditional. And you're not saying anything negative about traditional dental
Absolutely
implants.
not.
You're just saying
It's a wonderful way to go.
this is a less expensive version.
It's an alternative.
And it works.
It works.
It's
Absolutely.
effective.
And you know, I'm a dentist that loves to be able to make my patients happy. And where my practice is, I'm not in Beverly Hills. I'm not in in the high dollar district. And you know, my patients were coming in wanting dental implants, but typically couldn't afford them. And you know, I'd present it to them, but it was just not feasible for them. When I saw what the mini implant could do for them and also their pocketbook, I was absolutely sold on it. Once I found that the procedure works and that it is something that's easy for me to do and it's easy on the patient, it was a home run for me.
So you just want to be, I mean, really, I mean, your goal is to just do mini implants.
Absolutely, yes.
Every day,
that's what
you love it?
do every day because those patients are so happy and I can help them so much. And you know, typical dentistry, it's a lot of patchwork. You know, you patch, you do a filling here, you put a crown on a tooth here. This is changing whole mouths. This is enabling people to function again, or chew and smile and feel confident and laugh and not have to worry about their denture falling in the mouth when they sneeze. They are just so much happier. And I just take a lot of joy and pride in doing it.
So get a consult. Where does it begin?
In my office, I typically bring the patient in and take a Panorex x-ray, which is basically an x-ray around their head that shows their entire jaw, just to show the anatomical features in the mouth, the amount of bone they have. And it's a complimentary consultation and x-ray. We basically sit down and we talk about their troubles, and we get to know each other a little bit, and then after that we talk about what I can do for them, how I can improve their life, how I can improve their dentures, if they want to make me a new set of dentures, if they want me to make them a new set of dentures and secure them in, I will. If they want to use their dentures that they have, I can typically retrofit in about an hour and a half. I can retrofit a denture to
mini implants.
Put in, absolutely.
And if somebody, denture wearer is watching this right now, and they're still skeptical, okay? What's the turnaround time in a perfect world? Everything goes right. 7-year-old. When could they have their teeth in their mouth?
They could have their teeth in their mouth, and typically in a day.
Really?
Yeah, absolutely.
But they have to make a visit, though, for the x-rays.
Absolutely.
And then you have to get the teeth made.
I've had patients come in on...
But you have to get the teeth made.
Oh, I'm sorry. I thought you meant an existing...
Okay.
denture. Oh, no,
Okay.
I'm sorry. Typically in about 2 weeks.
2 weeks.
I'll say it's about 2-week turnaround.
Well, good.
Yeah.
All right. Well, I want to thank you so much. And this information is all on your website.
Absolutely.
You even have testimonials.
I do.
Patients that are bragging about their mini implants. Okay, good. I want to thank
happy patients.
Thank you for coming on the show. Very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.